So let me begin with a small introduction to the whole topic, and this is all about the women. And women's life, as all of us know, is wonderfully complex, and there is now the fact that they are all working, and of course the fact that most women have the last word. So basically, we need to look at breast cancer today. We are in that specialty, and it is also a known fact now that it's probably one of the largest cancers to affect women all over the world and in metropolitan cities like in Pune. How does cancer begin? And to go back to the grassroots of this whole anatomy is that the breast is made up of ducts, lobular structures, that is the parenchyma, the fat, and then these intervening white strands that you see is the fibrous tissue. And this is the fibrous tissue that gives the breast the shape. The gland gives milk, and the fat is just to fill up the gaps between the glandular tissue and the skin. Now, typically, breast cancer begins either in two places. One is in the ducts here or in the parenchyma. So, there are two main types of breast cancer. And basically, begins with the epithelium within the ducts that starts proliferating, then becomes atypical, then becomes a precancerous lesion, and that is known as the stage 0 of breast cancer. Most people know 4 stages, but people don't realize that there is a stage 0 of breast cancer, which is the ductal carcinoma in situ. That means it lies just within the ducts or within the terminal ducts or within the lobules and does not come out into the rest of the breast. So this is stage 0 of breast cancer. When this starts getting into the stroma outside the ducts or outside the lobules, then this becomes the stage 1 of invasive breast cancer, and that is where actually cancer begins. And then it grows in size, and till it's about 2 centimeters, it is in the stage 1 of breast cancer. When it becomes 2 centimeters and above, it goes into the second stage, so 2A of breast cancer. Then it spreads to the axillary nodes. The system in our body is that we have this lymphatic system which acts as our immune or the defense mechanisms, as well as drains a lot of lymph out of the limb, out of the breast, back into the body through into the veins. And that lymphatic system gets affected, then it becomes 2B. If the tumor becomes large and huge, affecting the skin, or it goes to the nodes and the nodes become multiple, they get matted, then it becomes stage 3. And of course, all of us know that stage 4 is when this same cancer goes to the rest of the body. So it spreads either through the lymphatics or through the blood vessels into the lung, into the brain, into the liver, into the bones. So these are the 4 stages of the disease, the invasive breast cancer disease.